Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, and question analysis sessions to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I like to always go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the and AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one, as we continue our diabetic series of questions, states which lab test is most commonly used to monitor long term glucose control in patients with type 2 diabetes? Is it A, a fasting plasma glucose? B, oral glucose tolerance test? C, hemoglobin A1C? Or D, a random plasma glucose? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what's being asked of you. So here, the stem is the question is the stem. So which lab test is most commonly used to monitor long-term glucose control in patients with type 2 diabetes, right? So what is this even saying? Which test are we using commonly to gauge the long-term control of a diabetic patient, right? Their glucose control. And the best answer is C, an A1C, right? Because if you think about it, an A1C evaluates over a 90-day period. So sometimes people can come in and do a fasting glucose and it's within normal range. But when you look at their A1C, then it's abnormal. So when we're trying to get a long-term glucose image, A1C is the most commonly utilized and the one that's deemed most effective by the ADA. All righty. Question number two. Which of the following is a primary indication for starting pharmacotherapy in patients with type 2 diabetes? Is it A, hemoglobin A1C greater than or 65? Oh my God, greater than or equal to 6.5% after 3 months of lifestyle changes? So I'm going to read that again. Which of the following is a primary indication for starting pharmacotherapy in patients with type 2 diabetes? Is it A, an A1C of greater than or equal to 6.5% after 3 months of lifestyle changes? Is it B, a fasting blood glucose consistently greater than 100 milligrams per deciliter? C, presence of diabetes related complications? Or D, a BMI greater than 30? Take a moment to tell me what you got. So the stem of the question is the stem is the question. The question is the stem. So which of the following is the primary indication for when we need to start medications for our type 2 diabetic patients? So based off of this, a few things you can eliminate. B, it's not even a criteria for diabetes. So just because they're consistently greater than 100 for fasting plasma glucose greater than 126 is that positive, right, for type 2 diabetes. So we can eliminate B. Just because you have a presence of diabetes related complications doesn't mean that we need to start medications or it's not a primary indication because, pay attention to those key terms of primary indication. So C, you can eliminate. But an A1C greater than 6.5%, and they have been doing lifestyle modifications for 3 months. So what does that mean? We've done an A1C, we brought you back even with lifestyle modifications implemented, and you're still having an A1C greater than 6.5%, you definitely warrant some type of medication treatment, right? Which is most commonly your metformin as your first line therapy, right? So A is your best answer here. And then lastly, C, question number three, lastly, Lord, I'm all mixed up. Uh, this one says, which of the following is an appropriate A1C target for a patient with type 2 diabetes and a history of cardiovascular disease? Is it A, less than 6.5%, B, less than 7%, C, less than 8%, or D, less than 9%? And I know I said C in the beginning, but don't think that's something that's telling you the answer. I do these questions so much that all this stuff is running together. All right, so here the question states, which of the following is an appropriate A1C target for a patient with type 2 diabetes and a history of cardiovascular disease? And the best answer is B, less than 7%. Now, I did this one on purpose because remember a couple of days back on the videos, I went over explaining to you somebody with type 2 diabetes, the goal by ADA, the American Diabetes Association, states that our goal is less than 7% because remember, they have diabetes. So we just want to maintain that they're less than 7. So even with risk factors or a history of cardiovascular disease, that doesn't change our threshold. We want you less than 7%. Now, I always throw these in because y'all always get mixed up on the less than 6.5% versus the less than 7. Less than 6.5% is for those who have not been diagnosed with diabetes. We want to keep that goal less than that. But the patients who have been diagnosed, even with other risk factors, we want you less than 7. Okay? So B is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number 1 at gmail.com. The things that I do offer are my review book, and thank y'all on the feedback on the book. I'm so happy that you are finding it helpful. But I do put a lot of things in it based off of how I approach studying, and I'm happy that it is working and resonating with you guys because it is short and sweet. It's not the heavy overload, but I do it in a fashion so that you can focus in on the things that you need to focus in on. Okay, so you can get it a paperback option or the ebook option. They're both linked in the bio of this channel. If you're looking to complete a self-paced review, that is also linked in the bio of this channel. It is designed for family and adult Gero for both exams. If you need to practice any of the QBank questions, they are linked in the bio of this channel. And then if you're looking to book any of my sessions, I always say reach out either by calling, texting, or emailing so that I can adequately gauge what you truly need to make sure that you are booking the appropriate session. Okay. All right, you guys. As always, y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.